So when it comes to some of the considerations with reducing the entry level or increasing the number of people in tactical populations, the first thing that needs to be addressed is why are people leaving, okay? And a number of people have said retention is probably the first place you should start to actually keep the people you've got in the job, because one, they're the people with all the experience. They've already been trained, okay? They're the ones that know how to pass on that knowledge. They're your mentors for the future generation or for the future people you're going to employ, okay? They're the ones who have started going through the leadership process, okay? All the people with experience pretty much hold all your corporate knowledge. So why not spend more time actually trying to retain these people rather than just let them leave in the hope that you can just train new people to replace them, because new people don't bring any experience, they don't bring any corporate knowledge. And as the level of experience reduces with really high turnover rates, your corporate knowledge reduces, okay? Your ability to mentor new people is reduced because they're being mentored by people with less experience, and it creates a number of huge problems, okay? There are some benefits to it, is that you can clean away some of the driftwood that's just hanging around in your organization, but ultimately having a higher turnover rate is a negative consequence, okay? So when it comes to retention, when we look at why people leave or the impact on people, okay, most people leave because they're medically unfit or they're medically discharged, or there's indications that the rate is twice as high for people to be medically separated than for them to voluntarily separate in a lot of cases or be medically unfit. Okay, and there's a number of factors to it. So there is the mental health side of things, or PTSD, or people just had a gutful, they're burnt out, okay? But when we look at it, it's not really the operational side of things. So a lot of people that join these organizations can reconcile, or they're kind of comfortable with what they're seeing operationally, because a lot of them joined it. Their values are aligned with what they're trying to do. So they can go through that, they can reconcile what they're seeing and what they're doing, and it's not really a long-term problem. They're able to recover from those exposures. What seems to have a massive impact, or a really significant impact, is the organizational stress. So the bureaucracy, the amount of red tape, the governance, okay, the obstacles and challenges to actually being able to do the job they signed up for is what seems to create most of the stress or most of the mental health issues, okay? And a lot of that also comes down to leadership, because people just don't like working for people that treat them like shit. So a lot of it is actually organizational issues. So by improving the culture, the leadership, reducing some of the barriers to people to actually be able to perform their job is going to reduce a lot of that stress, okay? And the other side of that medically unfit is the physical competency that people have. So in a lot of these organizations, there's a high physical demand, and if we reduce the intake requirement, then we're exposing people to risk of injury when it comes to meeting that demand or being able to carry out those tasks. There's also an issue with a lot of people not being held to a physical competency standard, okay? A number of these organizations don't have a standard when it comes to that. They just let people do whatever they want, become overweight, become obese. And there's a lot of information that shows that cardiovascular disease and chronic diseases are higher in some of these populations than they are in general population. So if we provide more opportunity, if we hold people to a standard once they're in, if we create better training programs, then we're going to improve people's physical competency, and we're going to reduce the risk of them getting injured when in these physically demanding roles, okay? There's some indications that within the military, physical training is probably the highest risk factor when it comes to getting injured and being medically discharged. So by having better physical performance programs or human performance programs, or a human performance program, we can reduce some of the factors around people being medically unfit, getting hurt at duty or hurt on duty, and then being separated due to medical reasons. Okay, so the first one we need to look at is retention. How do we keep the people we have in the job that they're in? Because they're the ones with all the experience, they're the ones that know how to do the job, and they're the ones that are going to mentor the current workforce or the current trainees once they come through. So the first place we need to start is in retention.